Here we see the kit required for performing a urinalysis. These are the standard multi-sticks we use. They are kept in a black container, as they are light sensitive. This is a white top collection bottle, meaning it does not contain any boric acid. It is used to collect the sample to be analysed. This is a larger, sterile collection bowl, used by patients who may find the small collection bottle difficult to use. Urine can be decanted from the larger bowl into a sample bottle if necessary. This is the urine pot that you send to the lab for microscopy, culture, and sensitivity. It contains a boric acid fixing agent. Before starting the procedure, you will need a method of timekeeping. Take a urinalysis stick. They consist of varying biosensors, sensitized for detecting certain markers in the urine sample. Ensure that they have been kept dry and in a sealed container. Unscrew the lid to your urine sample and submerge the stick. Dab off the excess urine and replace the lid to avoid spillage. You can interpret the urinalysis result electronically, or as first demonstrated, manually. Compare the urinalysis stick to the chart found on the biosensor strip container. Each biosensor develops after a set specific time. Times may vary depending on the manufacturer, but as is demonstrated here, glucose develops at 30 seconds, ketones at 40 seconds, specific gravity 45 seconds, blood, pH, protein, and nitrites at 60 seconds. Finally, leukocytes are interpreted after 120 seconds. Alternatively, you can process your urinalysis stick electronically. Dip the urine as demonstrated before. Place the stick on the development table and press the Start button. The urine stick is then interpreted automatically. Once the urinalysis is complete, discard the stick from the table and clean appropriately. The machine produces a printout of the results, which is fixed into the patient's clinical notes. If the urinalysis is suggestive of a urinary tract infection, the urine is transferred to a red bottle. This must be sent with a request form, clearly marked with patient identifiers as prompted. This should include any relevant clinical details. Don't forget to tick the MSU box. The urine is then sent to the lab for microscopy, culture, and sensitivity. This is a standard pregnancy test used in most trusts. It comes with instructions of how to perform and interpret the results. There are a wide variety of pregnancy tests available on the market, and you should familiarise yourself with the trust's brand. The pack contains a testing strip and a pipette for dropping the urine. Place 3 drops of urine into the well. After 3 minutes, you may interpret the results. In this case, 2 lines denote a positive test, 1 line denotes a negative test, and no lines equates to an invalid test, and the test must be repeated. Remember that urine beta-HCG is only detectable between 4 to 6 weeks following unprotected intercourse. A negative test should be interpreted with caution if the clinical suspicion remains high. Blood beta-HCG levels can be sent for clarity if the test is equivocal. Sometimes it is worth repeating the test for replicative purposes. Once you have finished with your urine testing, make sure that you discard of your urine in the designated sluice.